Good evening and welcome to the September 22nd, 2021 School Committee meeting. We are just returning from executive session. Please join us in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. We're moving right to public comment. Mr. Ragsdale?
We're not doing student representative.
Oh, sorry, you missed that. No, so that's actually for the next time, but Angeline's here to talk about the DECA trip, so we'll get to that when we talk about DECA. I'm sorry.
Okay. So we have two signed up for public comment. First is Lizette Packer. Please state your name and address for the record.
Lizette Packer, 34 Burlington Ave. I come here tonight to share a few thoughts. For the past 3 school committee meetings, they begin with a bunch of angry parents discussing not wearing a mask at school. I think wearing a mask at school is a small price to pay for education. I see a bigger problem here. I really think our kids' education is at risk and in jeopardy. We got all the MCAS reports and all the data across the whole nation shows that despite our efforts, our best efforts, it didn't really work for most children. If kids wear masks in school, they're not exposed. I believe that at no point in time is my kid truly less than 3 feet apart from another kid who are both unmasked. So therefore, they wouldn't be exposed and have to stay at home. I was really encouraged when I saw Dr. Brand's email regarding test and stay. And I thought, wow, this is like really a great program. And then I opened the consent form and read the consent form in full, which then also stated that I was consenting to test and stay and a new thing called COVID safety checks, which used to be called pool testing. It was my understanding that this entire committee voted against pool testing. So I personally am not going to sign that consent. I don't know if that's a consent that is just like a state consent and every town can like put in what they want and take out what they want, but that wasn't done here. So I'm just concerned that we are doing the safety checks, but we are also wearing masks. So my concern is, selfishly, I have a senior this year who's missed so much school already. I do not want to send my kid to college with like half of in-person learning. There's nothing better than in-person learning. I think the teachers would agree and the kids would agree. So if at some point that could be clarified in an email, or I think a lot of parents would feel a lot better and would move forward and sign that consent. And there's a bunch of people that are not signing it because of this new COVID safety check. So thank you.
Thank you.
Thank you. Next is Jeffrey Cohen.
Jeffrey Cohen, 18 Cobalt Street in Wilmington. Good evening. It's incumbent upon the members of the school committee to provide irrefutable proof to the parents of students that masks both prevent virus spread and infection before agreeing to any mandate extension. There isn't a single study that proves this. How can you even consider infringing upon constitutional rights? It certainly appears that you have your marching orders and are intent on carrying them out despite the complete lack of evidence. Regarding the curriculum, critical race theory is often disguised by educators using the words anti-bias, diversity, inclusion, and equity. These terms are not what they seem. First, it's important to note that diversity, inclusion, and equity are part of a major initiative in our schools. This initiative is directly tied to toxic critical race theory, as I discovered using a public records request, which anyone can do. Many teachers received emailed invitations for online training. One course is called, quote, Equity Landscape in LIS. library and information science, end quote. Here's the course content, quote, in this session, you'll learn about the state of diversity, equity, and inclusion in the library and information sciences, including a discussion of critical race theory in its place in LIS, end quote. This course is taught by a so-called chief diversity officer. Notice how CRT and equity are in the same sentence, and it's taught by diversity officer. The words diversity, equity, and inclusion are interchangeable with critical race theory. Another course summary states, quote, learn how white supremacy is baked into our institutions and how it manifests on individual and systemic levels in this insightful lesson. You'll learn how to spot both implicit racism and identify white supremacy at work, end quote. How can you be promoting this toxic stew to children and be able to go home and sleep at night? This twisted CRT ideology also believes that white supremacy is prevalent, which of course it is not. Some individuals responsible for teaching our children are essentially CRT activists. There has been a recent denial that CRT is not being taught in schools, but that couldn't be further from the truth. CRT is synonymous with so-called diversity, equity, and inclusion. Here are a few quotes from individuals. Quote, books that are more diverse than ones written by dead white men, end quote. And, quote, I do not see mention on the list doing an internal investigation on the whiteness that permeates our organization and how our organization supports white supremacy culture. Making statements, providing PD, and creating resource lists does nothing if it only happens through the white gaze. Whiteness permeates our organization and nothing happens unless through the white gaze. If this isn't racism, tell me what is. This racist ideology is being taught to our children. This poison must be fully excised from our schools, and those responsible for promulgating it must resign immediately. Thank you.
Thank you for your comment. The committee also received 5 written comments, which we have reviewed prior to the meeting. Is there anyone else in the audience who would like to make a public comment? Please come forward, state your name and address.
How are we doing tonight? My name's Joe Iantelli. I'm 5 Tacoma Drive in Wilmington, Massachusetts. Thank you for your time. I just want to bring up the issues of the middle school again with the lockers. I know I asked before for if there was a weight limit to the backpacks. They are very heavy. I know we have some middle school parents here. My other issue is the students did get lockers. This week, they got lockers. You know when my son's allowed to go to his locker? After lunch. After his second, it's called study period. After lunch. He can't put his stuff down. He can't go to his locker before to get books. He can't put his lunch in after lunch. Are these educators? I mean, really? Is this? We're going to give you lockers. My kid can't go to his locker until after lunch. Did the school board know about this? Do you realize that twice a day, his first time is after lunch? That's just ridiculous. Just very upsetting that this is our school system in Wilmington. After lunch, my son cannot go to his locker. That's horrible. And this is very, very upsetting. I hope the school board and Dr. Brand, I hope you step in on this. After lunch, that's the first time he gets to go to his locker. That's horrible. Middle school, like he's a 2-year-old. Awful. Thank you.
Thank you for your comment. Is there anyone else who would like to comment? Okay.
Thank you. All right. We have some approval of items by consensus. Approval of minutes, September 8th, 2021. Is there a motion? Thank you, Mrs. Burns. Seconded by Mr. Fennelly. All in favor? That's unanimous. We have acceptance of second reading school wellness policy, ADF. Is there a motion? Mrs. Burns? Second? Mr. Ragsdale? Discussion? Anything? Okay, all in favor? It's unanimous, thank you. Item C, we have acceptance of the DECA Student Leadership Overnight Field Trip, 11/19 to 11/21, and we have Angela Champa here to talk to us about that trip. Thank you for being here.
Hi, thank you guys for having me. I'm normally here as a student representative from the high school, but tonight I'm here on behalf of DECA to talk about our DECA Power Trip in Boston. And I brought packets about just a synopsis of what it is, all the guidelines that will be followed, and the benefits from students. DECA is a business club at the high school, and it's one of the largest. We had our first meeting today, and we had 113 kids sign up virtually as well, so we're very excited. This is an opportunity for our leadership team, which is made up of juniors and seniors. So we're all kids who have been in the club for 4 to 3 years, and unfortunately the past 2 years we've missed out on going to these leadership conferences. My sophomore and my junior year, I had the honor of making it to the national competition, but we weren't able to compete in the normal settings of going to California and Nashville due to COVID restrictions. But this year, we're finally able to go in person, and this is a really great opportunity for us to learn and engage with other students. Normally, the leadership conference, which we're asking to attend, takes place around the nation. Previously, it was in Chicago, but this year, as it's in Boston, it's a great opportunity that we may not have for another 4 years. So we really want to send as many students as we can. We're going to learn skills that we can bring back and apply in our own community, and it would benefit the students here, not just the ones that go, but everyone affected here, from students that are in business classes and in this club as well. I can answer any questions you guys may have.
Thank you. Always wonderful to have you here. Thank you.
Thank you.
Questions or comments for Angela? Mrs. Burns?
So now, are students, being that it's local, are you planning on staying overnight in Boston as opposed to commuting back and forth? Because I know that's happened in the past, too.
Yeah, a majority of us plan on staying overnight. I think there may be one student who may have a cheer competition, and they plan on commuting, but other than that, students plan on staying overnight so that we can participate in everything going on.
Wonderful. Thank you.
Other questions or comments? Is there a motion? Mrs. Burns, is there a second? Mr. Samaha, all in favor of approving the DECA Student Leadership Overnight Field Trip? That is unanimous.
Thank you.
Well done. Thanks for being here. I guess we'll see you at our next meeting.
Yes, I'll be here.
Thank you. Item D, we have acceptance of the equity audit motion. Is there a motion? Sorry, I'm not sure why it says motion, but is there a motion? I know, sorry, thank you. Sure.
Is the RFP associated with that? I'm sorry, I'm trying to bring it up now.
Yeah, to authorize, so the motion as it reads here.
Okay.
You got it?
Yep.
Yes, go
got
ahead. Do you want to read it? Do you want me to read it?
Well, this is just a motion, there'll be discussion, yes?
Yes.
Okay, great. I'd like to make a motion to authorize the superintendent to move ahead with the equity audit by posting the equity audit request for proposal.
Thank you. Is there a second? Mrs. Newhouse, discussion. Mrs. Burns.
I had raised a couple of questions to Superintendent Brand with regards to how the RFP is written. Actually, I have my notes here. If you don't mind, forgive me. I think it's best done because I had it nice and organized when I sent it to the superintendent.
Do you want me to pull that up, or are you?
I have it. Thank you very much. So I know that you were going to bring it back for discussion, Superintendent Brand. And I'm just trying to, I'm not a Google aficionado. Okay. So under the scope of work, I know I brought up that it's specifically, under the scope of work of the RFP, it specifically references students of color only. And I did bring up, what about those with disabilities or other diverse ethnic backgrounds? Granted, we do have first-generation students here from a variety of different countries. Granted, it's not as large as some of our urban counterparts, but still, there's that diversity, I think, even within our community, that's just so enriching under the scope of work. And under deliverables, bullet number 9, I commented that besides seeking retainment of staff of color, can't we include staff of other diverse ethnic backgrounds, just to broaden that piece, along with bullet number 11, including not only families of color, but other diverse ethnicities, only because there's a lot of, families of culture within our community. And in bullet 7, it kind of references that broader spectrum, and I guess I'm looking for it to be more balanced and, unilateral, as when we look at this audit, to look at all those areas for equity and inclusion. And so that's kind of what I would, if you don't mind responding, as to that's something that I would like to see expanded upon within this scope of the audit. And if I'm overstepping, or if it's too broad, I mean, I don't know if we could include that in the RFP when we put it out to bid.
So thank you for the comments. They were noted, I know, in our exchange, and I do think that we can certainly adjust this. The inclusion of the RFP here in the packet for your review is right, is to try and make sure that there's a broad level of support in terms of what this project, this audit would entail and capture. So I noted those, and we can certainly amend that and incorporate into the RFP before it goes out.
Very good. I think it would be favor of this RFP with those amendments.
Thank you. Any other discussion? Mr. Smile?
I'll just as a note, it is in, there's a bullet that says provide detailed analysis, and then it lists, maybe that's not the one. Yeah, race, ethnicity, gender, socioeconomic status, disability, and English language proficiency. I don't know if that could somehow be taken, those words, and sort of added on, so it's students of color and each of those things, because I noticed the same thing.
Thank you.
Good.
Yes.
Any other questions, comments?
I'm in agreement with what both Mrs. Burns and Mr. Samaha said with adding the broader.
Perfect. All in favor of approving? It's unanimous. Thank you.
Thank you.
We have warrants G07, FS 11, 12, 13, 14, 15, CF 11. Is there a motion? Thank you, Mr. Fennelly, seconded by Mr. Samaha. All in favor? That's unanimous. We have payroll ending 9/15/2021. Is there a motion? Mrs. Newhouse, seconded by Mr. Fennelly. All in favor? That's unanimous. We have SPED 01. Mrs. Newhouse, seconded by Mrs. Plowman. All in favor? And that is one abstention. Thank you. All right, Dr. Brand, Superintendent's report.
Thank you, and good evening, everyone. There are 5 items tonight under the superintendent's report, and we'll follow in order. All of them have items that are included in the actual packet for members of the community that may be following along. But to start tonight, it's my pleasure to invite Ms. Rebecca Brown forward. She's here with us as our, as you all know, as our interim coordinator of health services, and she has stepped into the role at really the last minute as we said goodbye to Ms. Crow, and I just want to take this opportunity and certainly thank and commend her for her incredible work. She's gone from 0 to 125 miles an hour in no time, and just done a great job working in partnership with our leadership team and trying to reconcile all of the different facets coming forth from DESE and other entities. And so she's here tonight to provide a broader update on the Test and Stay program as we prepare to launch that. There is information, as mentioned, in the packet, and we obviously have been socializing some of that with the community recently. And so, and anything else in terms of updates that you think are timely, Ms. Brown? So thanks for being here.
Thank you for having me. I think I'll start off in addressing one of the public comments. With the informed consent, it was a document that was created by DESE. We did get instruction not to alter it in any way. I have answered multiple emails. We are There is no interest on the part of Dr. Brand, on the part of Dr. Curto, on the part of any of the school nurses, myself, to do anything but the test and stay program. We are not doing symptomatic testing. We are not doing what they're now calling routine COVID pool testing. We are not doing those. But the instructions that we got from DESE, and I know it is confusing to some parents, was not to begin to amend the consent in any way. So the way the consent process works, Dr. Brian sent out information. It's very easy. Parents go on. You basically click into Wilmington. You click into your child's school, read through it, and at the end you give consent, and that goes into a secure database that each of the school nurses will have access to. There is every intention that if a child is identified as a close contact, before we would test any child, we would reach out to the parent and say, your child has been identified as a close contact, and I'll explain that in a minute. And before we would test any child, just as a courtesy, even if we have consent from the parent, we would reach out and let the parent know that. Close contacts, and I think that this is important for parents to understand. When we're talking about test and stay, we're only talking about close contacts that are related to school or school activities. So this is where it gets a little confusing, and I feel like I've lived this for a couple of weeks, but as a parent, I can certainly understand. If my child plays varsity soccer, and they have a and they're identified as having a close contact to another person on the varsity soccer team, they can go into test and stay. If they play club soccer on a Sunday afternoon, they cannot. And the reason behind that is because school activities, we have multiple mitigation measures in place, and we're wearing masks. We are social distancing. We have coaches that are on board with that. We have our teacher facilitators of clubs and DECA making sure those mitigation measures are still in place. We can't necessarily say that that's happening at club soccer, or we can't necessarily say that when one of our teenagers go to work in the evening that that's happening. So that's why the test and stay program is for close contacts identified either in the school setting, in the classroom setting, or a school activity. I know that's going to be, once we get into it, that's going to be different. That's going to be difficult because parents are going to say, why is Joey allowed to stay in school and do test and stay when Jimmy can't? And so that's the emphasis behind the program. I've got a lot of questions from parents about how it works. So depending on what day your child would be identified as a close contact, we would reach out to the parent. We would test them right then and there. So, at 9 o'clock in the morning, if we find out that someone's positive, we immediately start looking at classroom seating charts, lunch seating charts, and we begin to identify who we think is a close contact. Let's say it's a Wednesday. We would test Wednesday, Thursday, Friday. If the child is not having any extracurricular activities over the weekend, we would test Monday and Tuesday. If it's one of our athletes, if it's one of our DECA participants, we do have the ability to send home a kit with that child for the weekend so that they could test, produce a test result that they could either give to the DECA facilitator, a coach, so that they could participate in an activity over the weekend. The other part of test and stay that I think is a little, that we're gonna have to really make sure that parents understand, is that when you leave school, your child is still quarantined. So they can stay after school for DECA, they can go to varsity practice, they cannot go and work at McDonald's, they can't go to dance class. They're still really quarantined. They still have been identified as a close contact. So they can come to school, they can do extracurriculars, but after that, they're quarantined. And I think that that's going to be a little we're gonna have to really work with parents and help them understand that. And certainly when we identify any close contacts, I either have a conversation with a parent, a school nurse has a conversation with a parent. When I do it myself, I always follow it up with an email with like dates of quarantine, you know, where's day 5, where's day 8, this is what your child's allowed to do. But I think in the beginning, we're gonna have to kind of like sift out some situations with parents. Right now, if we were doing test and stay, we would have less than 5 children in the entire district that would be eligible to do test and stay. Because most of our contacts right now are in the home setting. It's either coming from a small child who's in daycare, who has it, brings it into the home, and then their siblings who are in school turn positive, or it's coming from parents who bring it into the home, and then their children are exposed. And I will say that a lot of those parents are fully vaccinated. So we have to really keep an emphasis on mitigation measures, because even if people are vaccinated, they're getting positive, so. I know there's gotta be questions, because
We're waiting to see if there's more coming, so thank you. That's very helpful, and thank you for being so transparent. I'm sure there are some questions.
Here's one more, Chairman Bryson. I think the parents got the consent. If your child is fully vaccinated, your child's never gonna be needing test and stay. Because if you're fully vaccinated, you're not a close contact. So you don't need to consent for your child to participate in test and stay.
Thank you. All right, questions, comments? Mrs. Newhouse.
For those students who are vaccinated, how do parents let the school nurses know that they are fully vaccinated?
So right now, the health record, electronic health record that we use in the school nurses, in the health offices across the district, we are able to sync with the Massachusetts vaccine program.
Okay.
So actually, I have the nurse at the high school tonight, and she ran, before I asked her around 2 o'clock, and she tried to do it. She tried to sync because I really wanted to bring to the committee, out of the 700 students we have at the high school, how many are vaccinated. She couldn't get the report to run through all the way through. It stopped at about 40%. So we think about half of our high school students are vaccinated, but we don't know that for sure because we hadn't totally synced it.
Other questions?
Is there a way, it's sort of a follow-up to that, is there a way for parents to sort of check? Because I know that, I think it was Dr. Curto had said that the accuracy of that Massachusetts system isn't always great. Is there a way for parents to check so that they can let the school know that their child is vaccinated if they are, or the child is not vaccinated if they're not?
We would be more than happy if parents sent in vaccination records. We would definitely enter it right in our health, electronic health system. We have our regular vaccinations that are mandated by the Department of Public Health, and we are able to add in the COVID, whatever your child got, whether, you know. So if parents send it in, we would definitely add it, or we can verify that what we synced is what, you know, you're providing for us. Last year with the prom, everybody that presented a vaccine card for the prom, we added all those into the record.
What's our anticipated start date?
October 4th.
Mrs. Plowman?
What is the pulse in terms of staffing, resources to be able to carry out test and stay? Are you feeling confident that your staff are going to be able to do this and manage it?
We are going to train on the 29th for CIT Day. CIC Health, which is the vendor that DESE contracted with, is providing what they call program coordinators. to the district. I already have supplies. The actual test and stay is quite easy. And then those results are entered into a secure database for test results. If we end up getting a positive, we enter it into the computer system, and that then goes into the Maven system, which is the Massachusetts database for anyone that's positive, which I have access to for the district. So that's the way the Board of Health will, I mean, we will, if we get a positive case, we will obviously trace it right away, but also it'll go into the Board of Health's database. Sure.
So while a student arrives to school,
Yeah.
receives their test, where do they go while they're waiting?
So our plan is exactly that children would either get off the bus, or our high school kids would come right into us at the beginning of the day. We would test them right away. They would go back up to the classroom. It's a 15-minute test. You basically read it like a pregnancy test. It has like a control line and then another line if it turns positive. They're very easy to read. If we needed to, if a child was positive, we would call up and pull the student, out of class. But we're hoping that I think Dr. Curto has talked about this. There will be some breakthrough cases. The way the test works, it does measure the viral load. So you can have a student who's been exposed. Day 1 will be negative, day 2 will be negative, day 3 will be negative, and maybe on day 4 they'll reach that critical viral load and they'll turn positive. And that will happen. That is the drawback of the Binax now, is you have to get to a certain viral load. So we will have, sometimes that will happen.
But the viral load is a key aspect of the contagiousness of it. So that, when you reach that viral load that it triggers the test, that's when you're
Right.
actually contagious, and like at the lower levels.
Well,
you may have it be positive.
Yeah,
except
I mean,
at
you
low
can-
viral loads, you're much less likely.
Right, so the curve kind of goes like this. So the viral load is going to be highest like up here on day 4 and 5. You still are contagious on both ends of the curve, down at both ends. You're definitely most on day 4 or 5. But we're going with the Binax now. This is what the test program offered us. It's definitely not as good as the PCR, but it's very easy to do in school. The recommendation from CIC Health is that any child over the age of 8 could self-swab in the presence of a nurse. I did get some parents that said, their children have some anxiety over things like this. Would they be able to come in and swab their own child? We don't see any reason why they couldn't, if that makes it easier, in order for parents to give consent and allow their child to stay in school.
And can you remind us what the current protocol is for identifying close contacts in terms of indoor, outdoor, distance,
So
duration?
outdoors, there's no close contacts, unless, you have like 2 little kids that are literally hugging each other with their masks off. But if kids are out on the playground, well, you know how kids sometimes, like but in general situations, if kids are just out on the playground during recess and they're playing and whatever, there should be no close contacts. In the schools, what we're looking at is less than 3 feet over a 15-minute period. I will say that all the close contacts that we've had in school, there's been none in the classrooms at all. The teachers are doing an amazing job at taking the distance that they have in the classrooms and maximizing it to the very fullest extent. They have, when I've gone to do contact tracing on the weekend, the seating charts are in the computer. It's really easy. I can just figure out. It does get a little dicier in the cafeterias. We have asked all of the teachers at the elementary levels to have the children sit at the same table, same seats. And in consultation with Shelley Newhouse and Tracy Mello, we look at each situation very carefully. It's not cut and dry, black and white. We kind of look at who, if it's a circle table, who's to the right and who's to the left of that child. If it's a table like this, the teachers have done a great job of kind of like putting the kids, you know, angling them. When it's like this across is where we get into trouble sometimes. And sometimes we will identify clearly close contacts, and these two children are both quarantined. Other times when Shelley and Tracy and I look at it, we may send an email home to the parent and say, your child per se has not been identified as a close contact. They can continue to come to school, but we ask you to monitor them very closely, and we strongly recommend on day 5 that they get a PCR. And those are the kids that kind of fall in that gray area that Shelley and Tracy and I kind of dice out, and we really kind of give it the situation the benefit of the doubt. And as of right now, we haven't in any of those situations come up with a positive case. So we feel pretty good at how we're trying to make these critical decisions. Mrs. Burns?
Just a point of clarification, please. When you were referencing the CDC protocols, close contact, less than 3 feet for longer than 15 minutes, with or without mask?
Oh, with their mask still on?
With mask. Okay,
Yeah.
thank you.
Yeah, and the teachers have done a great job. They're really limiting snack time, that the masks are off. In the cafeterias, who's ever in the cafeteria with the children, once the child is really like finished with their lunch, but they still may have an extra 10 minutes to talk with their friends and that, they're encouraging the kids to put their masks back on. Like, we're not rushing anybody to get through their lunch, but once they're obviously, their tray is empty and they're just talking with their friends, we're just asking them to put their mask back on, so they're not in the cafeteria for the whole lunch period with their masks off.
Thank you.
And luckily, the weather's been good, so a lot of the classes have been taking the morning mask break along with snack, and it's been outside. Mrs. Plowman?
Just a quick thank you, because I know that you and the nursing staff are working around the clock to stay ahead of this, and teachers are doing a really great job.
The teachers are doing a great job.
So that has to be noted, and families need to understand the nuances and how complicated this is. I anticipate for you the confusion and frustration, perhaps, of the scenario where they're testing and staying in school and not having to quarantine in that scenario, but then on the weekends being expected to quarantine at home.
Yep.
Can you help families understand why that is the case? I'm assuming it's related to Board of Health regulations,
Right.
not school.
Right. So right now, we don't have test and stay. So if I identify that you're a close contact, I would basically send you home. Today would be day 0 because you're the last day that you've had contact with me. You would need to quarantine in your home, and on day 5, you would go out and get a PCR, and if that was negative and you have no symptoms, on day 8, you'd be allowed to return to school. So basically, the test and stay program is giving you the opportunity to come to school and participate in school activities, but it's not really eliminating, per se, the need to quarantine. We're just allowing you to come into a situation where we feel with our mitigation measures in place that it's safe for you to be here. It doesn't necessarily mean that you can go to dance class or you can go to McDonald's and work if that's your, after-school job.
And that makes sense, and I think you really kind of highlight, because in school, we can guarantee that there are these other mitigation measures being
Correct.
followed to really minimize the potential spread if a person ends up being positive.
That's the whole basis of test and stay, is that in the school setting, in the athletic setting, in the DECA setting, that who's ever the facilitator of DECA or whoever the coaches of the football team or the school situation, that you have teachers and administrators making sure that those mitigation measures are in place. We can't necessarily say what happens on a Sunday at a club soccer game or what happens when a child goes to their after-school work situation, or a child goes to dance class, or a child goes to Boy Scouts. So
Thank you.
that's kind of the premise behind the whole thing.
That's helpful.
Mr. Exton?
Just following up on that, so you mentioned like a club soccer game, but then you also said before that outdoor close contacts are not considered close contacts.
Yeah, but the thing with like a club soccer game is, we have no idea what happens during warm-ups. We have no idea what happens after the club soccer game, where the family stops and gets an ice cream cone and they're all together. Carpooling, right. So it's not necessarily it's not necessarily that it's an outdoor sport, but it's that we don't know what mitigation measures are happening during that activity.
All right, any other questions or comments? Mr. Samaha?
Yeah, just more of a clarifying. So if a family decides to not opt in to test and stay, if they decide, so Wilmington offers test and stay, they don't sign the consent form.
Right.
They then have to follow what you explained earlier, the traditional, or I shouldn't say traditional,
Yeah.
but the old.
Right. So
The
if
old
that
methods of
happens, in my mind, I
quarantining.
was thinking about this, and I'm gonna discuss this with the nurses at CIT Day next Wednesday. If we identify that a child is a close contact, if we go into the database and the consent's not there, I still think it's important to reach out to that family and say, your child has now been identified as a close contact. We don't have a signed consent, but if you still are reluctant to allow your child to participate, your child's gonna leave and be out of school for whatever number of days, depending on how the weekend falls. And I'm hoping that maybe parents would reconsider with a conversation with a school nurse and to see, my child can stay in school if I agree to this. If not, my child's gonna be out of school for, miss 5 days of class or whatever, depending on how the weekend falls. I mean, maybe there'll still be reluctance to participate, but maybe a one-on-one conversation with a school nurse when a parent is actually facing the situation.
Mrs. Burns?
And I know it's a thought, but let's say a scenario takes place where you are reaching out to a parent to say, would you consider? So you wouldn't necessarily be able to test that child unless the parent is on the premises.
So what
The
we
thing
would,
is, because of verbal
Right.
consent, you know what I mean, it's,
well, we wouldn't take it verbal. What we
Okay.
would do is we would we would send, the school nurse can send a copy of the consent.
Okay.
It wouldn't go into the database at that point.
right.
And I don't know, maybe it would be able to still go instantly into the database. But we would have to get consent before we
Testing
would
would-
ever test a
very good.
child.
Okay,
But
I
I
just wanna
don't
make
think
sure
it's
clarity.
fair to just say, we're not gonna have a child participate because the parent didn't sign the consent. I want to give the parent another opportunity to,
I think that's perfect, though, the outreach, because I think so many parents are still,
yeah.
going in circles trying to keep up
Absolutely.
with, but thank you so much, that's,
Yeah, absolutely.
appreciate that extra layer, so.
All right. Thank you very much
You're
for being
welcome.
here and for explaining this to us in terms we can understand.
Thank you.
Thank you, Ms. Brown. Just maybe one concluding thought, and that is, for members of the community, that it's certainly the case, we all recall well, that last year during COVID, there were lots of different elements of our operations in which we had the ability to make certain decisions on our own that may have looked slightly different from a different district. What Ms. Brown just covered related to definitions of close contact, the test and stay protocols, and the parameters that envelops all of that. Just to clarify, this is not the Wilmington approach. We are following, whether it be CDC or the Department of Education, their specific guidelines, the rules, if you will. So I just think that point is important to underscore, that these are not Ms. Brown's rules and our approach in Wilmington that may look different from Burlington. That is not the case. Whether it be the test and stay program, or what happens if a student is identified as a close contact and that they are not vaccinated, all of those things are not germane to local decision-making. They're at a higher level. And we believe it's best to participate in test and stay I'll also take the opportunity to remind our community members that certainly for those eligible, test and stay goes away completely if they're vaccinated. And we're not talking tonight about that and where we're heading, but just to remind the community that the Department of Education still is maintaining an 80% vaccination rate, and only at that point in time in which there can be discussions at the local level to change course with that. So I thought I'd take the opportunity to underscore that. Ms. Brown, thank you again.
And certainly a shout out to Shelley Newhouse and Tracy Mello, because I do most of the contact tracing on the weekends and in the evenings, and they are always available. When I send a text message, in a very short period of time, I get a response back from either Tracy or Shelley. So Wilmington's very fortunate to have that support, and it really does keep us from bringing children into the building the next day that really we don't want to have in the building just because of, health reasons, no other reason. So thank you to Shelley and to Tracy.
Thank you for that. All right, item B.
Sure.
Focus, Jeff.
The other items here are moving away from COVID-19 and close contacts, and as I think about them all this evening, really reflective of other work, other activity that is unfolding or has unfolded in some cases in the district. They're not connected necessarily, but just timely updates. Item B, tiered focus monitoring results. I'll turn it over to Ms. Elliott.
Sure. So during the last school year, we participated in what is called tiered focus monitoring with the Department of Education. It actually started spring of 2019, the year prior, but the majority of the work we did during the last school year. So this is a typical process that all school districts go through where it has been, so there's a coordinated program review, but now they look at different aspects of our curriculum and how we operate at different junctures. So we were considered Group B Universal Standards and in this review cycle, and they looked at areas such as licensure and professional development, parent-student community engagement, facilities, classroom observations, oversight, time and learning, and equal access. During the winter, we uploaded more than 60 artifacts, different documents, evidence of each of the different indicators that they were evaluating for our district in those areas. And we worked with the Department of Ed to, as we submitted things, they might have asked for additional information, additional clarification, or they might have looked at a handbook and said, oh, you need to add this to that. So it was a very productive relationship throughout the course of that time during this evaluation process. And it, from my personal experience, it was a much more positive, productive, collaborative process than it had been years before, which was very much of a give us everything and then we'll just write you a report. So this was, I thought, an excellent working relationship where we were able to, they'd ask, do you have this in place? Oh, yes, we just didn't know you needed that. Let me give you that document as well. So I'd say it was a very positive thing. In the spring, we had virtual, there was supposed to be on-site visits, but they were virtual visits. They interviewed different members of the community, different members of the administrative team, and I think our CPAC had representatives that were interviewed. And then they have not, so then we met with them again in the spring. We had an opportunity to do some training with them on one indicator that we were struggling with submitting the information that they were looking for. So we did some training around that. And then they released a report, which really, actually not the full report, but they gave us an update in the summer with how we did with everything that we submitted. So out of the multiple indicators that we submitted, we received only, we were in compliance and they were fully accepted, all of them with the exception of one indicator, which we received a partially implemented status. And that's the indicator that I referred to that they provided some PD for us around as well. So the indicator is Civil Rights 25. So I'll just read you what the actual indicator is so you can hear the language, but a review of documents and staff interviews indicated that the district does not annually evaluate all aspects of its K-12 program to ensure that all students, regardless of race, color, sex, gender identity, religion, national origin, limited English proficiency, sexual orientation, disability, or housing status, have equal access to all programs, including athletics and other extracurricular activities. And as I mentioned, we were partially in compliance with this because we do a lot of these things and have a lot of this work in place. However, we did not have a systemic way to annually measure each of these different aspects and components. We can look at certain reports and see, do all students have access to sports in the same way, but we don't have a way to capture that data easily and annually on a regular basis. And so the department has, they collaborated with us to draft an action plan and a timeline for us to address this one indicator. And you can see in the memo there, I had linked the action plan for your review as well. It's basically, they're asking us, and we'll be working with them to develop protocols and survey tools to basically survey all stakeholders to determine if all have access, but this work will follow the timeline listed, so we will be developing the protocols, implementing them, training all of our staff on how to implement them, whether it's a survey or our own internal equity walk or audit or whatever it might be, and then share the results as well and have that information. And once we submit all of that following the timeline and in the action plan, the Department of Ed will issue our full report for all of the whole tiered focus monitoring. And that will be posted on our website and shared with the greater community, obviously with the school committee first. I'm open to questions if anyone has any.
Thank you very much.
Sure.
Questions, Mr. Smaha?
I'll say thank you for going through this whole process and everybody that was involved. I mean, 65, whatever that number of documents, artifacts, whatever it happens to be, is a crazy amount. So I know that it's a lot of work, and I think that this makes sense. I think if we sort of take in the equity audit that we approved earlier tonight, that's going to add another layer to this process as well. So thank you for the work.
I just wanted to add to that comment that I appreciated that the action plan was included, because admittedly, reading through the memo, I had questions, and then I clicked on this and it answered all of my questions. So thank you for saving both of us the trouble. But curiosity, there's a couple of sort of dates and check marks in here, and I was just curious if you would provide updates sort of at each step, or were you just going to wait till the full report was done? I don't have a preference either way. I was just curious.
Yeah, I mean, I'm happy to provide updates if the committee would like. Either way is fine with me. I'm happy to, even whether it's a formal update, at each one or halfway through, whatever makes sense, I'm happy to do.
Thank you.
Mr. Baxter?
The timeline says that the first thing we need to do is by December 3rd, that we'll be developing and submitting newly developed protocols and procedures and so forth, and new tools. And then by February, we have to basically start implementing that's when training happens. In that interval between those two, is that something that we get feedback from Decion? Do they need to approve essentially like the plan at that point before we actually begin the training? And
so when we submit I haven't gone through this part of the process before because the whole process has been revised, but if it's similar to how we worked throughout this whole process, I am assuming that once we submit the protocols, they'll give us some feedback right away to say, yes, you're right on track, or maybe you should tweak this before you implement. They've actually given us samples from other districts who've also had to implement CR 25 and had a plan. So they've given us lots of examples to go from as a good starting point. So I'm pretty confident that we'll be able to get that feedback before we fully implement so that we're not backpedaling.
Okay. Other questions? I'm just wondering if the SEAM equity, diversity, and inclusion position will be involved in this work.
Yes, actually, we brought that up in a recent meeting, and I'm scheduled to meet with her next week and hope to share this work with her and get her input along the way, definitely.
Thank you.
With that, okay, moving on, 6C, school councils. In your packet, there's a memo that I provide to you just as an effort to restart our work associated with school councils. And so I thought I would take this opportunity and just, I know that most members of the committee are aware of this, but certainly for members of the community, there are a couple of things that I think are worthwhile to point out. And first off, like a lot of things, unfortunately, our school council activity has been rather dormant the last approximately year and a half for very understandable reasons. But as we take our stride towards returning and trying to resurrect things that we should be operating, I think school councils is indeed one of them. There is an intersection with both Mass General Law as well as your own school committee policies related to school councils, and so I just utilize this opportunity to remind folks of what that is. You do have three different, or a couple of different policies relative to this. Under Mass General Law, all public schools are supposed to have their own school council operating. I think it's worthwhile to point out that this is not the same as what we often use the term here as a PAC, or a Parent Advisory Council. And I do understand the confusion that sometimes can be at play. School councils have certain requirements, and they are not a fundraising arm or a fundraising entity as PACs tend to be. And so the memo, as you can see here, just outlines some of the key things that really have to be in place and really what shapes their operation. They're public entities, and as such, they follow open meeting laws. Memos agendas and minutes and such should be taken. There's some certain language around school meeting requirements. But I think most importantly, as I point out there and remind folks of, there's really a couple of fundamental roles of school councils. The adoption of educational goals for the school itself, the identification of the educational needs of the students attending the school, the review of the school building budget, and the formulation of a school improvement plan. And that's the final piece just this evening. Really looking here, not necessarily for a motion unless you think that appropriate, but the consensus, or the sense, sorry, of the school committee to modify slightly one aspect of your policy. And that aspect pertains to the school improvement plans. Your policy calls for an annual submission of school improvement plans. And as I point out and suggest for your consideration in the memo, I'd like to amend that just a little bit. I've talked with principals about their efforts to get their councils up and running in the fall, and I know that many have started that work. You can see the timeline that I draw out there, but knowing that everything is just taking a little bit longer, with all respect, to get things up and running, I'd like to suggest that what we talk about here is approximately a 1.5-year school improvement plan to allow the councils to come together, to take stock, if you will, of where they're at as a school community, give thought to what the most important aspects are of that improvement plan, go through the same process that we have in the past, and that's bring those plans for superintendent approval and to you to share. And that this would be a proposed plan that would span approximately, as I outline, 1.5 years. So I'll pause there if there are any questions. And again, it was my thought of just getting a general sense of the committee, but certainly if you want to take a motion, I suppose you could.
Well, we can discuss. I think that we should bring it to the policy subcommittee probably, and then bring it back as a first read next time, but go ahead, Mrs. Burns.
I don't think it's necessary, only because I would consider this COVID pandemic related, and that it would only be a hiccup. We're not changing policy, we're just approving. I think we should, because it's a policy, I think we do need to maybe approve this motion, because as opposed to having the individual school improvement plans brought forth to the committee for consideration and vote, we're delaying that so that they can get their councils up and running and get the goals for the following year, 2022 and 2023, together. Having served on a couple of the school advisory councils, I really have to say it's such a rewarding opportunity to collaborate with school administrators and staff and other stakeholders with regards to the plans for the individual schools, and I highly recommend parents are interested to do so. I think it's a great opportunity to collaborate in the goals of the school of which your students are attending. So, but I would just say that because this is a divert from our current policy, that we approve it in the sake of COVID
Right.
timescale, and to return back to our normal process once this is passed.
So I hear what you're saying, but I think also this is a superintendent's report, not typically a time where we would be approving any language. So I think and so I'll wait to hear from other people. I feel more comfortable bringing this to the policy subcommittee to bring back to our next meeting with these dates. I would imagine anytime a policy comes up, it's always a good opportunity for us to take another look at it, just to really make sure it says everything we want it to say. So if we're going to be adding or changing anything, even just adjusting the timeline for the next year, I think it makes sense to bring it to the policy subcommittee to take a look at it and bring it back. But I'm listening to it.
I'm not disagreeing with that. I think that's a good measure. But what I'm saying, for me, and granted, it's just my glasses, that I look through things, is that we're just changing the dates as, a one-time juncture. So that's where I don't know if language necessarily, because policy is already created. I think we're just changing the rollout of the dates in which our policy dictates. So that's all I'm saying, and I have no problem either way.
Yeah.
bringing
And I
it.
think if we wait, it's not going to actually affect the work they're doing, but Mr. Smaha.
That's actually what I was just gonna say is, I know, this work can get started, even if we move this off and we don't take any action on it tonight and we wait for the policy subcommittee to do it. Because I was just sort of writing out, okay, because I was agreeing with you, I said, okay, what would we be voting on? I sort of tried to scribble something out, but I think it needs a little more thought than just a scribble. I think that maybe it makes sense to keep it with send to the subcommittee, because we're not gonna delay any of the work, so. And then
I
we
have
can
no
bring it back
reservations. I just thought that,
to vote on later.
It was just
Yeah.
a change of calendar and not language. So,
Correct.
like I said, I have no reservations. I just bring it forth to the board.
Other thoughts, Mr. Exton?
I'd just like to explore the timeline a little bit more, so that traditionally, we tended to receive school improvement plans at the end of the year, in advance of the coming year when they would be implemented. But we were still forming the councils early on in the fall for the most part. And I know the principals are already on their way. I've received 3 emails already from 3 different schools with invitations to school council, so that work is definitely underway. So this seems to me an accelerated timeline, that normally the school council has more time to do its work and present a school improvement plan. And here, we're talking about them presenting at the end of January and approved plans being in effect from February. But I mean, how much implementation or change is going to happen between February and the end of the year? So I don't quite understand what we're getting from that compressed period of time from now until February being the time that all that work gets done. And I understand that then we don't have to do it again under this proposal for kind of until the following
It was,
23
yeah,
school year.
a fair question, a good question. It was my thought that indeed there could be some things that rise to the surface and are actionable now, or this school year, rather. And so if that were the case, to be true to the process, to be true to what I think a school improvement plan, points to, the thought there would be, if there are some things that are, important to tackle or get into now, in the spring, for example, that they could be highlighted within a plan. It's a plan that the community's aware of, the school committee's aware of, and that things could move forward. I suspect that there'll be a number of goals that may emerge through these plans that won't take any shape or won't start until next school year. But it was just that thought that they could sort of broach the 2 years and still be moving forward if there's work to dig into. If that makes sense.
Mrs. Burns?
The other thought to kind of piggyback on that is that there was work going on when we went to remote. And perhaps, and granted, things may change and they may not be the same focus or goals, but at least they have a foundation, which I think that at the very least that they would revisit to see about proceeding with those goals, or if those goals have changed or the priorities have changed. So So there was, when that aspect kind of closed down with the schools, that was kind of left hanging. So at least they would have something to start from. But you raise a very valid, very good point.
Any other questions or comments? All right. Does anyone, so I'm going to again recommend we bring this back to the policy subcommittee. Is that okay?
Yes.
All right, great. Moving right along, this is a very long superintendent's report. I'm not exactly sure how this unraveled.
In history.
Yes, okay, moving right along, please.
NAEP, item 6D is informational only, and I provide this to you, recent correspondence we received from the Mass Department of Education, Elementary and Secondary Education, regarding our forthcoming participation in the National Assessment of Educational Progress, or NAEP, as the acronym goes, at the middle school, and you can see that information included there, and I won't expand upon that unless there are any specific questions and time is marching on. And finally, informational as well, item 6E, middle school committee. I know that there has been interest by members of the committee here in terms of where that work is at, and as I try and outline in the memo, the intention is to continue to move forward with that work after some unfortunate delays. But as I outlined there, we have work in the background in terms of partnering with Ms. Likas, our consultant, who helped support our work with the strategic plan, and discussing how she may be able to help us and partner with us, as discussed previously, in moving forward this work. This work will, again, very much be shaped around the opportunity for stakeholder input, which includes our students, our staff, and our parent, guardians, and caregivers, and of course, members of the community. And a proposed revised timeline there in terms of moving forward this work. And I just wanted to bring that to your attention. Happy to take any questions if there are on that, and if not, that would be it for me tonight.
Are there questions or comments about the last two items? All right. All right, so that brings us to old business. There is no old business. Moving right into new business, we have item 8A, the SEL staff introductions, panorama overview presentation. We have some guests. Dr. Brand?
We do. Thank you so much. So it's with great pleasure that we have our three individuals making their way to the microphone. You know Ms. Murray, Christine Murray, but so pleased, I'll let Ms. Murray introduce our two SEL key people that we brought on board. And we've talked about this before, that one of the many things that I think our community and families should be so grateful for, the support that you as a committee have given to us as a district moving forward with some really, I think, really significant stakes in the ground around attending to social, emotional health and well-being of our students. I think we can all recognize that there's a lot of people paying lip service to this, as this was true before COVID, was certainly through COVID, and moving on our way, hopefully, out of COVID. But I'm really pleased and proud of the collective support, again, that you as a committee and our other key leaders have given to trying to move forward in a very, very significant way around social emotional learning. So tonight's presentation is to provide an update on some of the work that they're doing, and also the panorama suite that may sound familiar to you, and that was we talked about last spring in this room. And so with that, I'll turn it over to Ms. Murray.
Thank you, Dr. Pran. Thank you, school committee. It's always a pleasure to be here, especially in person. So great to see you all, and we're very excited to offer you the chance to meet the two new SEL specialists. We have Erin Dunham and Lauren Sabella, and we'll get a little bit more into their bio. We'll also be talking a little bit about the family night that they produced already this year, the back-to-school night that they had, the family wellness survey that went out, and all the results from that, and basically provide an overview, as Dr. Brand said, about our panorama data that we were able to survey our students in June of last year. So I would like to introduce, here we go, a little bit of their bio. So Erin, who is over here, very experienced, 17 plus years experience as a case management director at a
for at-risk youth and families in collaboration with the Department of Children and Families, so she brings a lot of experience through DCF. She has over 12 years providing home-based and school-based counseling for children and families. She has a strong background in trauma-focused therapy and strategies, techniques to manage anxiety, depression, and truancy. Lauren Sabella has over 5 years experience promoting social-emotional learning in schools, over 15 years experience counseling children and families in a variety of settings, experienced offering a variety of trainings to staff and families on topics ranging from reducing anxiety, trauma-informed teaching, promoting positive behavior, collaborative problem solving, and positive parenting skills. So a little bit, sorry, I'm double here, it's spinning. Erin will be working at the Wildwood, the Reuben Street, the North, the middle school, and the high school, and Lauren will be at the Boutwell, Shawshene West Middle School and High School. So they'll both be helping to really look at that vertical alignment of clinical services to ensure positive transitions from school to school. So really an added support to our clinical team, using some of that crisis-based counseling, short-term, pandemic-related, individual group counseling, but really offering support to families in need, and we'll get a little into that with the family survey that was given. A big part of their position is outside of the teacher contract, so those hours outside of school, really looking at some of that crisis management or that family engagement that takes place after school hours. And really both of their goals, our goals as a district, is to monitor the SEL panorama data, to really look at interventions and supports, enhance that family engagement piece, strengthen our tiered mental health systems and PBS teams. They've already been on a bunch of our PBS meetings, and a great resource to those groups. But really supporting our staff, coaching our staff with social emotional learning, providing trainings on 51As, and how do we really follow those procedures and policies. Trauma-informed teaching, having that trauma-informed lens in a classroom, where students are coming from different experiences from the pandemic, and how to best teach all students at that tier 1 support. Really diving into Panorama, they have an intervention playbook that we'll get into a little bit, SEL curriculum, and really supporting our special ed programming. So those are really overall the goals. There's so much more, but we had to have a focus when we sat down and we came up with some of those together. So I'll let Lauren and Erin talk a little bit about what they've done.
Thank you so much, Christine. We're so happy to be able to be here tonight. Like Christine said, in person. Erin and I both come from kind of the mental health world, and we recognize that the past year and a half, soon to be, before we know it, 2 years of living in this pandemic has been, overwhelming for all of us. We think that this is a great opportunity to be able to be a part of Wilmington Public Schools. We did get to do some work over the summer together, and the first thing that we decided to do was to kind of get a jump start on easing that transition into the new school year. Obviously, unfortunately, COVID isn't completely over, and we recognize that there was likely going to be a lot of anxiety of coming back to school, what that was going to look like from the remote hybrid world to in person. So the first thing that we did is we offered a back to school parent night on Tuesday, August 24th. It was recorded, so the recorded session is available on the Student Services website. And we essentially gave some tips and tricks on transitioning back to school. We talked about anxiety, we talked about schedules and routines. We just talked kind of overall about, how to help support your kids and understanding that it may be a little bit tough, but it's okay, and we're going to all get through this together. As Dr. Bren said before, it's not here we go again, it's we got this. And we really loved that kind of mantra going into the training. We did have 15 parents in attendance, and we were able to, like I said, talk about expectations for the start of school, what it was going to look like, and just some, I apologize, I'm repeating myself, tips and tricks of transitioning back in. So that video is available on Student Services. Obviously, we've started school, but if parents want access to that, it is available, as well as a resource page that we created with some helpful links to books that talk about school and transitioning back wearing masks and all that fun stuff, to kind of help a variety of children at a variety of ages for what they may be experiencing.
So as a department, we anticipated that the student needs over the coming years would really center around social emotional learning and mental health. As a result, a wellness survey, a family wellness survey, was sent to parents and caregivers prior to the start of the school year. The survey really allowed for us to check in and better understand what our students and families will need to feel safe and supported socially and emotionally, as well as transition into a new school year. The family wellness survey results were consistent with our expectations with the previous family wellness survey that was sent out in August of 2020, as well as national trends. We were very pleased with the engagement from our district families that participated in this survey. So again, referencing the survey that was sent out in August of 2020, there were approximately 563 responses. For the survey that was sent out in August of 2021, there were 712 responses. The next slide, sorry. The next slide really breaks down the survey responses based upon school. And what is very noticeable to me is that the responses from the north and west side of towns were very similar, which we thought was really positive in terms of engagement overall throughout the district.
Some of the questions that we asked were related to, of course, COVID-19. So one of the questions that we asked was, to what degree is your child anxious or worried about returning to school, specifically as it relates to COVID-19? So we wanted to ask this question directly, how is your child doing? What is going on? We were pleasantly, surprised to see that over 64% said not worried at all. So that was kind of a really reassuring feeling to be able to support our kids transitioning in. About a little over 27% somewhat worried, and then about a little more than 5% reported often worried, and 2% reported extremely worried. That teeny tiny microscopic sliver represents families that did the survey but did not complete this question. So those were your options: was not worried, somewhat worried, often worried, or extremely worried. And that was broken down into like how often the student was referring to or talking about worrisome things. So this could include situations like worried about having to wear a mask, worried about getting sick at school, worried about social distancing or not seeing their friends. It was nice because we also did get some narratives. This was just kind of a multiple choice question, but there were also opportunities to kind of fill in informational data. So the next question relates more about either general anxiety or any kind of other social emotional needs. So we wanted to ask more broadly because there's more or other things going on in our lives other than COVID. Are there specific areas of social emotional well-being that you would like to learn more about to better support your child at home? So we asked this open-endedly. There was kind of a fill in the blank, and obviously we're not going to report out in school committee those confidential responses about what parents were kind of concerned about for their kid. But we did want to know, out of those concerns, if we were able to support some trainings for parents, kind of like the one we did at the beginning of the school year. Erin and I or the Office of Student Services would love to bring in other supports, trainings, resources, and we wanted to know what parents were interested in. And again, not surprisingly, anxiety and depression was the most popular topic. Again, anxiety is something that seems to be on our forefront, whether it's COVID-related or general anxiety-related, so that was not a surprise to us. Pleasantly surprised to see social skills training, as that is our forte, that is why we're here. So we're going to be continuing to work within the schools to building social skills and building up our social emotional curriculums. We can also do those trainings for parents if that's something that parents want to engage in. Other options included routines and structure, mindfulness, information around suicidal ideation, technology use, or that's kind of like cyber safety, or other community supports. So these are all really important topics, and we're going to continue to build our resources to be able to provide those to parents.
So again, as Lauren had mentioned, there was an opportunity for parents or caregivers to kind of fill in a little bit about what a specific concern or worry that they had. And in terms of themes, what we noticed is, of course, there was a theme around just general anxiety related to COVID-19 and the pandemic, especially for students who are returning remotely. We also saw just a lot of family-related issues, so just overall health of families, any changes in family makeup, social and peer-related issues was also a theme, and just if there had been sort of some pre-existing anxiety or depression that students were experiencing, and how to sort of manage and understand that going into the school year. What I do really like about the survey is it really did give us, Lauren and I, an opportunity to introduce ourselves to the community, to communicate with parents and caregivers as well as students, and so it's been a really nice sort of springboard overall.
I appreciate you mentioning that. Again, a question not displayed for everyone to see was, would you like outreach from a social emotional learning and family support specialist? That is our super long title for you all to memorize. And pleasantly surprised, a lot of parents said, yes, we would love outreach. So Erin and I have already begun meeting with administrators and school counselors and reaching out directly to families who have said they wanted our support. And those supports have ranged from, I was just curious to see who you were and what you could offer. And some are actually, in contact with us with connecting to outside resources, or just, again, strengthening that homeschooling.
All right, so the district has partnered with Panorama Education, so kind of pulling this all together, the SEL specialist, some of our objectives that we were talking about back in the spring. Panorama was another avenue to really strengthen our social emotional support in the district. So Panorama is an assessment, universal SEL assessment tool and data system to help educators really understand students' social emotional skills. So this survey was administered in June 2021, and we will be implementing it 2 to 3 times a year. We're looking at aligning it with the report cards, so coming up in October, November, and then again in that May time in the spring. So the good thing about Panorama, there's, in addition to the survey, there is a whole playbook that has a bunch of resources from many SEL sources, different curriculums from Second Step to Open Circle, all related to the 5 core competencies, which we will get into here a little bit in the alignment from CASEL to the Panorama survey. I'll let Erin kind of go over those.
So we worked closely with the Panorama team to create our survey and ensure that it aligns with the Collaborative for Academic, Social, and Emotional Learning, or CASEL's 5 core competencies. So on the left side of the slide, you'll see the CASEL competency, and on the right-hand side, you'll see how it aligns with the survey topics through Panorama. So the first competency of self-management for CASEL aligns with the Panorama survey survey topic of self-management, which is how well students manage their emotions, thoughts, and behaviors in different situations. The second CASEL competency of self-awareness aligns with Panorama's self-efficacy survey topic, which is defined as how much students believe they can succeed in achieving academic outcomes. The third competency on the CASEL side, which is responsible decision-making, aligns with Panorama's survey topic of emotional regulation, which is defined as how well students regulate their emotions. The CASEL competency of relationship skills aligns with Panorama's survey topic of social awareness, social perspective taking, which is defined as the extent to which students consider the perspectives of their teachers. And then finally, the CASEL competency of social awareness aligns with Panorama's survey topic of social awareness, which is how well students consider the perspective of others and empathize with them. We also had the opportunity of adding our own topic, which we chose as being sense of belonging, which is defined as how much students feel that they are valued members of their school community.
So as a district, we were very pleased with the participation and the implementation of our first survey, especially at the end of the year with the hustle and bustle of everything going on. And by the time we partnered with Panorama and got the whole partnership going, we really were kind of stuck to the last few weeks of school. Actually, I think the closing date was the last day of school. So the response rate was very good across the district, with 99.5% of teachers completed the SEL teacher perception survey at the pre-K to grade 3 levels. So they really took, it was about 4 questions that they would identify each student in their class and how they perceived their emotion regulation and various other competencies. 72% of the students completed the competency and well-being measures, so it's a self-reported survey that students took, grades 4 through 12. We did notice a discrepancy. We were wondering why the numbers were a little bit lower. It was after that senior time that they had left. So we can imagine the numbers would be higher if the seniors participated in this survey. So that's hence why we will move to May next year and get the seniors involved in that.
So in looking at some of our results across the district, we looked at the different percentiles around how teachers identified their students on the following CASEL competencies. So for self-management, around 50%, that's social awareness, 71%, self-efficacy, 56%, emotional regulation was pretty high at 79%, and then social perspective taking around 47%. Again, as someone working in social emotional learning and doing a lot of children and family therapy, these numbers are not surprising to us. Again, if you think about our preschooler through 3rd graders, social perspective taking is not a strength, right? I mean, if we have our 5 and 6-year-olds and we ask them how somebody else feels, they don't really even understand that question. So this is, again, the teacher perception of how the student is doing with that skill. So what that is telling us with this Panorama data is that this is a skill that we need to help our students work on. Again, with the self-management, again, preschool through 3rd grade, self-management is a skill that we're still working on. So these numbers are not surprising to us, but it is helpful data for us to have for how we can target and build up the competencies and skills in our pre-K through 3rd graders.
Can I jump in with a question here?
Sure.
These percentages, can you explain exactly what they are? Is this the percentage of students that teachers perceive as having these skills? Is it like a binary, you have it or not? Or is there
So it's a
some kind of
percent,
scale?
yes, sorry, I apologize to cut you off. So it's a percent as how they answered favorably. So each student, each teacher rather, answered 4 questions for each student. So so out of the questions they may have for like self-management, it would say, how well does this student, regulate their be able to sit at their desk, or something. It would be a concrete thing to identify self-management, and it would kind of rate how well this particular student could do, and the teacher would be the one rating it. So these numbers, are these also compared to national data, or
Not
are those
for
the next
teachers,
ones? Okay.
because it was their
What kind of
perception.
scale are they rating?
So do I have
So
the
it's,
exact?
so for example, a
Oh, you
question
have
would
the
be
questions. Oh,
overall,
good.
how focused is the student in your class? So very focused, mostly focused, so they pick the top 3 favorably that you would pick going down.
So these percentages here are the number of students, the percentage of students who, or rather, the percentage of students for whom their teachers rated them in this case.
Correct.
As one of those favorable responses, so somewhere in like the vary somewhat, but,
Yes, yep,
okay.
and that might just be explained a little bit easier.
As we go on.
I don't know why it came out kind of funky up here, so sorry about that.
What's nice too is the teachers have access to all of that data. So the previous teacher may have filled it out on, Mickey Mouse. Mickey Mouse now has a new teacher. The new teacher now can see what the previous teacher rated Mickey Mouse and says, oh, okay, well, Mickey Mouse really struggles with following directions. So that new teacher can say, okay, my goal is now to figure out through the playbook what things I can do to help Mickey Mouse follow directions, and see if the next time we do their survey, Mickey does better at following directions. So it is a teacher perception of how the student is doing. And again, this was during COVID world. So I think it's all, again, kind of we're taking this with a grain of salt of how well they attend to a partial screen. So I think that's also something to take with a grain of salt.
So then when we look at the students, I don't know why this came out like this on this
Yeah,
end, but
it
I'll
looks
try to
nice on
explain
ours.
it as best as possible. So here are the district results for when we look at a student competency and well-being surveys, grades 4 through 5, where students reflect on their own mindset. So the survey topics are on the left, the percentage results are in the middle, with the percentile scores for national comparisons on the right. So the percentage score, as we just explained, means the percent favorable. You know, a high score means that a student is reporting feeling more positively about a topic, where if they scored a little bit lower, they would be feeling not as positive about that topic. So when we look at this, we're pleased to see, again, when we added this sense of belonging, that 89% of our students felt a sense of belonging at the 4th and 5th grade level. There was not a comparison for that, just because we customized the survey to add that. Since we so we were unable to receive that, but while 54% of our students rated themselves favorable for emotion regulation, although that might look like we put it in yellow as an area of growth and to focus on, when we compare it to the national average, we fall on that higher percentile, which was nice to see.
It says 80 to 99% if you can see it. It's hard to see with the pink.
Okay, so when we look at grades 6 through 12, again, the survey topic is on the left, the result in the middle, and then compared nationally. So when we look at 78% of our students selected a positive answer choice for feeling that they're able to manage their emotions, their thoughts, and behaviors in different situations, so that self-management piece. While 52% of our students rated themselves favorably for self-efficacy, when we compare that to the national average, we fall a little bit lower compared to those national average. So this is an area of growth that we're looking at. Students are having that, if you want to call it self-awareness, and it's a little bit less confident that they're really feeling that their outcome of academics is
I do remember that we looked at the questions in this one particularly because we were interested in, like, okay, what does that mean? So I believe one of the questions were the amount, what percentage of things that you learned this year do you feel confident that you'll remember and be able to take and apply to next year? So again, understanding the year that we just went through, it's not surprising to say that, 6th through 12th graders are saying, I don't know that I'm going to retain a lot of that information that I learned this year into next year, because the learning style of so many students, it was not ideal in this situation. So again, not fully surprising. We're hoping to see significantly higher numbers. We have some questions.
Oh, go ahead.
Yep. Just a quick question. Are we able to also dissect this data even further to look at individual schools and how students rated in that way?
Yes. Yes, the teachers and the schools have that data, again, to protect confidentiality, because it does have students' names on it. Only the teacher who has that current student would have all that data, and the building administrators would be able to see it. So, like, as a district team, we can look at kind of school, district-wide trends and information and kind of look at the different things. But this will be, again, a goal that we're going to be working on this year. So we've created social-emotional goals to be looking at this data, practicing this data, using this data, and using it to go forward. So each teacher will have their own data of student level, all of that, and then building administrators will also have it for their entire school.
Just a quick question. I noticed kind of a correlation between social awareness and social perspective taking. They're kind of, I think they kind of overlap one another. And I think students who look, their perceptions, on that, it can be, whether it be askew, but is it common, I want to say this very generally, that those two areas typically fall in the same percentile range, or have you ever seen where one doesn't impact the other?
So we did not design the Panorama survey. We do not work directly for Panorama. We're
Right.
just using the tool.
Okay, so you've never had access to the national percentile as it pertains, is that, I'm just sorry.
I haven't looked at previous years of data.
Gotcha.
No, I
Okay.
haven't been able to dig that deeply into it to be able to answer that accurately.
Thank you.
I do think that it's a fair assumption to say that if we're struggling with self-management and self-awareness, that it would also, we would struggle with the ability to perspective take, right? A lot of these social emotional skills do certainly fall on one another, and especially if we're thinking that self-efficacy piece is low, that I can't retain my own information, it kind of has that trickle-down effect of, how they feel about themselves and where their skill levels are at, which is why I think it would also be, I think it would be personally interesting to see the 6 through 12 if we did have a teacher versus student comparison, but, since they're old enough to kind of rate themselves, it's more important that we get their genuine feedback than how somebody else perceives them.
It's that reading the room perspective, an aspect, are you reading the room?
Right. But can you read the room through a computer? Is I think the other thing to kind of be mindful
Or
of
with
as well.
the mask, you know what I mean, on, so that, so, thank you very much, Leah.
Yeah, great. Thank you for your question.
And I think that goes into a little bit of what Lauren was just talking about, kind of the next step. So yes, we were very much into the district data, looking at kind of those trends and what was going on, and then really looking at the school-based data. We gave all the principals that. Classroom teachers had time to briefly review that. We had a training on 8/31. It was a whole overview for staff, which was great. So continued professional development. There is a lot online with videos and different tools and resources that teachers can access and really dive deep into different ways to provide check-ins and various interventions for students. So again, there will be information coming out to families regarding our next round of the SEL survey, which will be hopefully the end of October, beginning of November, and then again in May. So we just want to leave you a little bit with some of the takeaways from our staff from the training, and we were calling them takeaways glow and grows. So what do we see out of this training? What sparked us to really move forward and do some of this work, and really look at the data and make some actionable changes. So weave SEL practices into classroom routines and activities, identify students who need support and matching interventions with specific needs. I really like the check-ins that you can customize. I would like to do those as often as possible. Creating an inclusive team-centered environment and making sure all students feel connected. So that was some of the feedback that we got, and I know it was a brief overview, and there is so much in Panorama.
A lot of information. Yeah.
We are still learning all the ins and outs of the system, but it really has been a great support to have the SEL interventionists as well as the Panorama for our district.
Glad to have you.
Thank you.
So welcome, and thank you again for your support as a school committee on all this work.
Thank you so much. I'm sure there are some questions and comments. I don't usually start, but I have a burning question. So I'm going to just go. Can parents ask teachers for access to their child's report or
So I do
results?
want to share today something that was, so Erin was a part of an IST, which is an instructional support team. So if a student is having difficulty academically, behaviorally, social, emotionally, a teacher can refer a student to that team and really discuss some interventions to put into place to help the student. So they actually were looking at Panorama data today.
It's very exciting.
So I've been very happy to hear that it's not just, academics that we're talking about with interventions, that we're really looking at some of these scores and how we can best improve them for students, classroom, and then, like we said before, as the district. So it really can go down to student need, and but yes, parents are able to, we're hoping to have these results the next time around for parent conferences, so they can do a quick printout of how their student scored or how their teacher perceived them at the younger levels. So that will be data that will be useful moving forward. It might take a little while with, it happening right at conference time, but it's something definitely that we'll be able to access some of those reports individually.
And if there was something very concerning, has that already been highlighted and so kind of behind the scenes is being worked on? So if something came up in this and a child was like, ooh, I want to touch base, is that already happening behind the scenes?
Yes, when we had that initial training on in August, that was kind of the first chance that teachers got to kind of look at their individual student data, and it actually kind of marks it in red, right? For if a student put all zeros or all something negative, that would flash right away, and that would kind of be brought to our attention about kind of what's going on, I haven't heard of anything dramatically concerning in that way, or I would hope that we would kind of know about it, but we have been, like I said, in contact with building administrators, school counselors, school psychologists. We've been really working closely to build relationships with teams across the district, and this is data that we're constantly being looking at. So it's more of, the questions are more specific, and then they rate the category. It's not necessarily something that talks about necessarily their, like, directly to their self-esteem. Like, it's not a universal screener, if that makes sense, that it wouldn't necessarily bring up warning signs of those types. But the kind of the wellness survey did bring up where parents said, yes, I'm very concerned. Those were addressed right away. The wellness survey kind of gave us more red flags, as I would say, than the panorama. The panorama is more of skill building and, like, where are these skills at, whereas the wellness survey kind of gave us an in-depth look about, is there, a mental health crisis that needs to be addressed right away.
Thank you so much. Mrs. Plowman?
So just to piggyback on that, so my experience with these kinds of assessments, which is fantastic, is that we have all this data, but then it's like, okay, what do we do? And I find that we do better typically in schools with tier 2 and tier 3 supports, because it's sort of like, okay, I know what that child needs, or I know what these 4 kids need, and I'll pull them into a group and we'll do some, skill building around a topic. I would love to hear in the future some initiatives, like building-based initiatives at a tier 1 level. How are we addressing, like, building-based, red flags or yellow flags even, that kind of pop up? And how are administrators working in collaboration with you? And how are educators working in collaboration with the clinical teams? Because I would love to see Wilmington be a leader district in being able to scaffold SEL throughout the day. I think that's always, as a fellow clinician, it's always our goal, is to see that school-based counselors, school psychologists are not just the only people in the building kind of holding this responsibility. I see that all the time, where I see teachers feeling, overwhelmed and I don't know what to do, and they call you and they have a kid leave a classroom. And I think it's just a much more effective approach when we are working at a tier 1 level. So I would love to eventually hear how this data is informing SEL implementation at a tier 1 level, and how educators are being a really active part of that process too. I just think that they just have so many opportunities to do, to plant these little seeds with kids all day long. So
we've been working closely doing SMART goals. It's that time of year that we're working with all educators to come up with that tier 1 support in the classroom, school-wide, working closely with administrators. So we will have district goals, there'll be school goals from the administrators, but also educators are really taking an SEL look at the goal and how to best improve in their classroom, as well as the school. So we're really working hard on kind of the SMART goals. We were doing them today.
I'm very proud of that work that Wilmington is doing. So.
I just want to say that I totally agree with you. I think that, promoting social emotional learning in the classroom is where, would need to start, and to have, tier 1 in every classroom, in every grade would be ideal, but it's just going to take us some time to get there.
Yep.
Just to add, in my short time being in the district, I've been quite overwhelmed with the degree of knowledge that educators and administration have about their students. And in working with the whole team, so the clinical team, administration, and educators, really getting a different but very unified view of what that student's needs might be, and how we can work collaboratively to meet that.
Great to hear.
Sorry, no, Mr. Small.
Oh, it's
No,
actually-
Mr. Rexduffer, sorry.
Oh, sorry.
He had his hand up for a while.
Get in line. So you both work at the middle school and high school level, and then at the elementary level, looks like Erin is on the north side of town and Lauren is on the west side of town. And one of the slides under the roles, it talks about working towards vertical alignment of clinical services for positive transitions. Can you speak a little bit to horizontal alignment, because that's an issue in our district with the two sides of town, and I think that that's an important aspect of the question as well, that we need both the horizontal and the vertical.
I appreciate the question. I come from a very close neighboring district. I won't say which one, but I grew up there, and I also recently worked there. So coming to Wilmington, who we may or may not have played in football, it was interesting to learn about kind of that there was like a north side and a west side, and it was, so to me, I love that both Christine and Alice, took us in over the summer, and they made us a part of that conversation. They said, hey, here is our town, what makes the most sense? And we did kind of talk about different ways to kind of divide and conquer, and the reason we chose this particular way is because of the lineage of the family. If there was a family that had, a kiddo in, an elementary, an intermediate, and the middle school, or, one in the high school, we would be able to work with that one family throughout whatever that family needs. It's also why we kind of bridge that gap at the middle and high school. So we do share those schools where it kind of collides. Erin and I also work, we met and we instantly said, okay, hi, you're my new best friend. We meet, I wouldn't even say weekly, I would say daily. If I don't get to see her, I'm like, what happened today? So we're closely collaborating about what is happening on each side of town. We may be physically located in one or the other, but if something's going on, we're going to connect with each other. We're going to say, oh, well, what does this school have? What does this school have? How can we connect it? Especially when it comes to social emotional resources and tools. So Panorama kind of bridges that gap where everybody has it. So we're going to really utilize this tool, which I only realized today in probably the, month that we've been playing with it. And I said, oh, it has Open Circle, it has Second Step, it has Mind Up, it has all these resources. And I was really excited to see that it had so many things in it that it's going to take us a minute just to understand and learn all the resources that we have. But Erin and I plan to work horizontally as, up, down, diagonal, whichever way it is, we want to be seen as a resource both in and out of school regardless. I mean, if something's going on at the Wildwood and she needs us or she needs Christine, I mean, coming from another district, I'm very happy to be in Wilmington because although you guys may be divided, you have a very strong student services team. I haven't been part of a team or a district that has so much staff that has been present for so long. It really is, I think, unique to Wilmington that you do have a lot of strength within your school community. And I understand that there may be some unofficial lines, but we will do our best to kind of bridge that gap so that regardless of what side of town you're on, you're getting both Erin and I's conjoined brain and all of our resources together.
I always say, I think they balance each other well. Between the SEL curriculum, the counseling piece, it's really been, we just kind of bounce off each other for our expertise to help in all schools.
Yeah, she has a lot of clinical and outside resources, and I've been in schools lately, so like if I need something, I reach out to her and vice versa. So you're not getting one, you're stuck with both of us.
It's been a really, really nice partnership, for sure. Yes, I'm clearly the talker.
I'm the shy one.
And I'm just, I don't know, here for the ride, but thank you very much. We appreciate your support.
Jay, do you have a question?
Sorry. That was 20 minutes ago you raised your
They're
hand.
done. They're like, we're done. Okay, we'll see you later.
So my question, I sort of have two questions, but I guess one of my questions was sort of related to what Mrs. Spanlin was asking about the tier one, the educator supports in the classroom. You had mentioned like the playbook. Is that something that, and that's through Panorama, correct? So that's something that, the teacher's looking at their results for their class, they can go right into the computer, get a playbook, and they can do something like if the majority of the students in the class are having trouble in this one area, they could do something and be aware of it.
Yes.
And so is that how it works?
Yes.
That is how it works.
It's very user friendly. I mean, we've spent a lot of time just sort of, playing around and exploring with the playbook, and they're very quick. They can be very quick, simple strategies, and they're obviously adjusted to meet sort of the age of the child. So it's really a fantastic tool.
Quick and easy because the teachers, there's so many things to do.
Exactly.
Like having something quick and easy is a key.
Very
key
little to
aspect.
no prep involved.
Yep.
That's, for teachers, that's perfect. My second question is, it's really actually just about the wellness page. I know you'd mentioned it, and you said there's a couple of resources that are on there. I guess just for parents and people that are home, if you want to access that wellness page, is it like right on Wilmington Public Schools like website? Right there for
Under the
you?
Student Support Services page, there is, I believe, the flyer from the presentation, and then there is another section, it could be under behavioral health. So we kind of put stuff on the homepage, and then there is more additional resources under the behavioral health page. So the video,
Okay.
I believe, is under the behavioral health.
So the,
No, that's just the,
oh, that's just the flyer.
So I was just playing with it. I think you actually need to go, the way I got there was Student Support Services from our district page.
yeah.
Yeah.
And then from there, I was like, where is everything? And I did have to click
there it is, yeah,
on
resources.
behavioral.
It's under events.
Social. Oh, I think I went to behavioral social.
It's under behavioral health,
Oh,
social emotional learning.
Yeah, so click
update,
on that
and then-
tab. And then that brings me to the handouts, the events,
Yes.
the recordings, et cetera.
We are looking to update our resources on our website too, as we have more with Panorama and just things are coming at us that we want to get on there as well. So we will continue to,
I think, yeah, I think it would be great. I mean, this might not even be, I mean, this might be more of a technology thing, but just having, it have a little bit ease of access to
Yep.
to some of this information. Because I know for a lot of families, this is really weighing on their minds, and they really want to have some of these resources. They're not always ready. It's not always easy to make it to this event or that event, so they want to have it, you know, because if you have to click through 3-4 links and you get the kids and you're cooking dinner and you get the lawn, it's like, where am I going with this stuff, you know, so.
Thank you. Mrs. Burns?
Just a quick and easy
Sure.
question, nothing too involved. Are you planning on doing the behavioral health fair in the spring?
so the Behavioral Health Task Force will be, it was last year with COVID, it was just too hard to have a committee going.
Or
with-
effective, you know what I mean?
Yes,
in that
yes.
realm?
And in place of the fair last year, or the last time we had it, was more, speakers and family engagement. So I think we're going to still be creative with how we can bring as many resources to the community, to our district community, but it might not necessarily be a fair. I know the attendance was kind of low the last time we did that, but we were open to any suggestions on how to kind of have a big community event, but also have outside agencies there. And so whether it's called a fair or, something else that we have in our planning, we will definitely be offering those types of things throughout the year.
Very good. Well, I think that those events, granted, I do hear you, and I understand, it also offers for parents to co-mingle, do you know what I mean, and build that rapport. And so it's and then of course, the workshops offered, too, is another added bonus, but it's hearing other people's stories in those settings.
Yes.
That it's not, really don't have that opportunity to do so in any other setting, and so I just to plant a seed, if not for this coming year, maybe the following years, hopefully as things start relaxing and, it does have a positive impact, I think, to families, so.
Great. Thank you.
Thank you.
Thank you. Thank you, everyone.
Thank you so much. All right, our next item of business is the 21-22 MOA. Is there a motion? Mrs. Newhouse?
I move that the school committee approves the school year 21-22 MOA that
Is
was
there a second?
discussed.
Thank you. Mrs. Plowman, all in favor? Are you with us?
Can I abstain? I mean, just because I wasn't in the executive session earlier, and I wasn't privy to all of that, so is
You certainly
is
can.
that okay to do?
Yes,
I'll give you my
absolutely.
blessing this time.
Yeah.
Thank you. Okay.
So we had, did you see that, Tracy?
6 in favor, 1 abstain.
Thank you.
Thank you.
Sorry, it took me a second.
Yeah, I'm sorry, I wasn't like,
Thank you very much. Other reports, I know we have a Weft update. Mrs. Plowman?
Yes.
Thank you for adding that. Thank you for sending that over and adding that to our packet.
Yeah, sure. So the Weft board met last week for the first time this school year. I just want to shout out a big thank you to all of the board members of Weft for the time and the dedication that they give to supporting Wilmington Public Schools and our students and our educators. The meeting times this year have shifted to evenings on Tuesdays per some feedback from the board and community volunteers. I just want people in the community to know that you can attend meetings without having to be a board member, and everybody is welcome to attend. There are newly appointed officers for this coming year. So thank you to everyone who really stepped up to that challenge, filled all of those positions, and thank you to all the former officers who had given years and years of service to the Weft. Lots of great discussion happened around fundraising ideas for this year. The one coming up first is our annual Halloween Weft Walk, which looks like it will happen this year, which is great. Thank you to Ms. Stinson for her coordinating efforts and all the volunteers that make it happen. Just a reminder that the Bay State textile boxes, I'm going to keep repeating this just to support the Weft and their efforts around this. That's a significant money-raising effort for this district. I don't know if families know that, but we have to be mindful not to overstuff the boxes and to not leave items on the ground, because that could be taken from us. So if you go to a box, yay, good, but if it's full, just go to a different school perhaps. I think every school in the district has these boxes, so there's lots of other spots you can drop. So to learn more or to sign up to volunteer, you can go to wilmingtonedfoundation.org. That's my subcommittee report.
Thank you very much. Much appreciated. Any other subcommittee reports?
I have a very brief report. As you guys know, I, with Mr. Ruggiero, sit on the subcommittee for the proposed new town hall school administration building, and we met last week with the subcommittee for the new senior center as a sort of joint subcommittee with the two project architects for the two building sites, and reviewed the selection criteria and the matrix, and a site was sort of put forward as the preferred site for both of the building projects. And so the sites that were reviewed, you guys are probably familiar with them, but St. Dorothy's, the Whitfield School site, the current existing town hall site, and then the town green, which of course is across the street from where we are now. And so taking a number of different factors into account, the number one site that was chosen to move forward for the senior center building would be the St. Dorothy's site. And the top choice for the new town hall / school administration building is actually the town green site, so right across here. So obviously a number of steps still to go in the process. The next step would be a recommendation was sent to the town manager. The town manager will bring it to the Board of Selectmen, and they'll make their decisions. So certainly plenty of work to do and more to come, but took a big step in the process last week. Paul, did I leave anything out?
No, if you all said, I'll just.
Yeah, because you got, thank you.
So the town manager mentioned tonight, actually, during the meeting, that next Monday, on September 27th, the OPM and the two architectural firms will be attending the selectmen meeting at Town Hall and during that period, as Jesse mentioned, the town manager will recommend to the Board of Selectmen these two sites for both projects. And then, so there'll be a presentation on the process we went through to select the sites, and then the recommendations and so forth. So everyone's invited to go. Jeff had mentioned, the town manager mentioned, might be like the second item on the agenda, so around 7:30 he's guessing. So again, next Monday, selectmen meeting, so we'll talk about the two projects.
Thank you. Thank you both very much. Did someone have a question? Okay. Mrs.
One more quick.
Oh, I'm sorry. I'm sorry.
Just that CPAC is meeting tomorrow night for the first time this year at at 6:30, and it's virtual. And I believe an email was sent out to everyone in the district.
Okay, great, thank you.
You're welcome.
Mrs. Burns, any correspondence?
None this evening.
Okay. Future school committee dates, we have our regular session meeting October 13th here in this room, and October 27th. Anything else before we adjourn? No, is there a motion? Mr. Fennelly? Seconded by Mrs. Newhouse, all in favor? That's unanimous, thank you. Good night.
Good night, everyone.